now begin the dissection of the superficial back. Keep in mind that we just went through the surface anatomy of the back and some of the major landmarks you will have to keep in mind as you dissect through the layers of the muscles of the back. First, palpate for the spinous process through the skin. Now, using a scalpel, palpate for the external occipital protuberance on the cadaver, and also palpate for the sacrum. Using a scalpel, make one long, deep incision right down the midline, reaching to the spinous process all the way along the back. Now, also using a scalpel, cut a number of skin flaps horizontally so that you have an easier way to skin the back. As you cut these lines horizontally, you will begin to systematically skin the back and pull the skin laterally. One way to provide traction for cutting is to cut a little buttonhole right here through the skin on the corner. Have one person put the finger through the buttonhole and another person pull back and provide traction while you cut with a scalpel to remove the skin and reflect the entire skin flap laterally. We'll do this bilaterally. And now you have exposed the muscles of the back. Keep in mind there may be layers of subcutaneous fat and some fascia you will need to remove to expose the muscles of the back. Now we will continue with the superficial muscles of the back and then proceed on to the deeper muscles of the back. The first muscle that you will see on the superior portion is this large diamond-shaped muscle here. This muscle is the trapezius muscle. You will find the trapezius muscle on either side. They will be attached to the spinous process all along the midline and then travel laterally and attach onto the spinous process of the scapula here. So that's easy to remember. It attaches to the spinous process of the vertebrae as well as the spinous process of the scapula. You will begin to reflect and cut its attachment to the spinous process of the vertebrae and reflect this muscle superiorly. And you will also need to cut its attachment to the spinous process of the scapula and reflect this muscle, both of them, superiorly. You will see a nerve and an artery, which we'll need to dissect out with small dissecting scissors, that will run on the deep surface or the internal surface of the trapezius muscle. The nerve that you will see here is the nerve, or the primary nerve, that will supply the motor innervation to this muscle. This nerve is the spinal accessory nerve, or cranial nerve number 11. The artery that you will see traveling with the spinal accessory nerve, this artery here and here, this artery is the superficial branch of the transverse cervical artery. Again, the superficial branch of the transverse cervical artery, traveling with the nerve, which is the spinal accessory nerve. Now, as we did in the previous demonstration of the surface anatomy of the back, we've palpated the medial margin or the medial border of the scapula. And I've told you that the muscles that occupy between the medial border of the scapula and the spinous process of the vertebrae are the rhomboids, and you can see them here. This muscle here traveling here and here, these two muscles, rhomboideus minor and rhomboideus major. Rhomboid minor and major. And above rhomboid minor, you will see this muscle here and here. The muscle above rhomboid minor, or superior to rhomboid minor, is this muscle that attaches to the superior edge of the scapula. This is the levator scapula. As you can imagine, when this muscle contracts, it will pull the scapula upwards towards the midline. These three muscles comprise the muscles that are medial to the scapula and lateral to the spinous process of the vertebrae. These three muscles, levator scapulae, rhomboid minor, and rhomboid major, all three share a common innervation. But all three of them are innervated by the dorsal scapular nerve. Let's travel a little downward. As we travel downward, we'll see a large flat muscle here running in this direction, and its counterpart on the other side running in this direction. This is the large flat muscle called the latissimus dorsi. As we travel more inferiorly, you'll see that the latissimus dorsi will insert into this large, thick, fibrous aponeurosis. This diamond-shaped aponeurosis here, this white-colored aponeurosis here, is the lumbar fascia. The thoracolumbar fascia offers attachment for